Jordan Voigt, president at Genesis Medical Center Davenport. We're part of Genesis Health System that covers Eastern Iowa, Western Illinois. So I'm responsible for a 502-bed licensed facility, and we do about $390 million in net revenue every year.
Jordan, thanks so much for making time joining us on the Ivy podcast today on a Monday morning. Before we dive in and talk about your current role, current organization, which I'm very excited about, give us a thumbnail version of your career to date.
Yeah, I went to undergrad at Augustana College in Rock Island, Illinois, and then went straight to graduate school at University of Alabama at Birmingham. It's a 3-year program, 2 years academic for a master's in healthcare administration, and then a year-long fellowship. Came and did the administrative fellowship here at Genesis Health System, and I've been here for about 10 years, of which most recently been president of the hospital the past 6 years. So after the year-long fellowship, did a couple different roles in service line management on the outpatient and inpatient side, and then was promoted a couple times, and most recently, like I said, 6 years ago, to president of the hospital. So
that's
been kind of the lay of
exciting.
the land. Yeah, well, thanks for having me.
Yeah, that's a very diverse background. I appreciate the insight, telling us a little bit more about it. So give us a little bit more insight into your current role as a president, what falls under your purview, and maybe a little bit more about Genesis Health.
Yeah, Genesis Health System, we're a 5-hospital health system. So we do about $700 million in net revenue every year, of which I'm responsible for almost $400 million of that net revenue. So day-to-day responsibilities, how do you balance quality, safety, the patient experience, employee engagement, physician engagement, growth, and then financial stewardship? So it's interesting being president of the hospital. Every decision you make has an impact, whether it's on the physicians, the frontline staff, the management, the government relations aspect. And so how do you balance all that, especially in an era of declining reimbursement? There's a lot of pressures on the cost side within the healthcare industry, and having a balance of that, where every year, unfortunately, now you're going to get me going because I get passionate about this, but unfortunately, every year we're having to reduce $25 to $20 million of expense because our reimbursement's going up less than 1%, but the cost aspect is going up multiple percentages. So that's what entails in my day-to-day responsibility. It's exciting, it's fun, it's dynamic. Every day is a different day, and I enjoy probably the most working with the medical staff members and the different medical specialties. It's always fun and exciting and learn something new.
Right. It seems like a lot of different hats that you're wearing, and definitely enjoying the process. So you've been, in healthcare space for quite some time, and so you've seen the industry go into, through different cycles, different iterations. As far as where we're going on, what's happening right now and what's going on, through the next period, what are the different trends that you're very excited about? What are you researching? What do you predict to be the next big thing?
I think the next big thing, how do you shift and match the volume demand of inpatient to outpatient? So historically in healthcare, you always think you get sick, you go to the hospital. Well, there's much more preventative measures that can be taken to keep you healthy. And we always do what's right for patients, but every time you come to the hospital, on average, the hospital gets reimbursed. And we're shifting from a volume to the value, where the incentives for the healthcare industry will be stay out of the highest cost area. However, if you have to come here for the hospital, we're going to treat you well, we're going to provide high quality, and we're going to get you back into the workforce or back within your own community. And so the incentives are changing. So it's fun to watch those dynamics. But again, it just adds more and more pressure, because here at the hospital, we're dealing with the highest acuity patients. And again, our mission is to take care of all the health services for all those in need. So we take care of uninsured patients, Medicaid patients, Medicare patients. We're not just necessarily cherry picking the market. So getting back to your question, it's exciting to see the transformation. It's just we're all under pressure to reduce our costs as the shift moves from inpatient to outpatient. I think one unique aspect that we're doing is the workforce challenges. Everyone's struggling with workforce, but in particular within nursing, respiratory, patient care techs, we're taking an international route. So actually today is the first day we have some of our international nurses that will be arriving here within the institution, and we have 25 international nurses. We've worked hard to strengthen and grow within our local community, but more and more jobs, nursing, you don't have to be at the bedside. Insurance companies are hiring nurses, outpatient centers, and again, more shifting inpatient to outpatient. And so we need to add more supply within our market. So we're going the international nursing route, and I think that's the way of the future.
Right, absolutely. And I think it's it's definitely exciting space, especially coming out of pandemic, so to say. There's a lot of different trends that's, we've experienced in the past, year and a half or so, which is, very exciting to see what's coming up next. In terms of just from overall perspective, you being the president of your organization, when it comes to building and fostering that culture of innovation, I'm pretty sure that's one of the, at the top of your minds 24/7, whether you actively seek to build such environment or not. In terms of staying ahead of the competition or even the market trends, what are the different practical strategies that really help you succeed in this space when it comes to building and fostering the culture of innovation?
I think one of the biggest aspects is taking care of our workforce. In particular, why would you want to work at the hospital where you only get paid a couple dollars more? You have nights, weekends, holidays when the patient load is high, you're mandated to stay late. And so we work on employee engagement and fostering a culture of positivity. So you get me passionate on this topic, but there's a book called Happiness Advantage that Sean Aker has written. That's all, how do you change the context of your lens? And there's been studies done that your success and how you view and how you are viewed as successful, 90% is the context of your lens, how you view it. 10% are external events that occur. So we went through the Happiness Advantage training, which is actually called the Orange Frog, through the International Thought Leader. And we've trained 1,500 of our frontline staff. We've also trained about 250 medical staff members through doing 2 different offsite events. And so we have a culture of innovation that we're building here, of engagement. Because, John, how many times do you walk down the hall? Hi, how are you? You say good. And you say, how are you? You're not listening to them. They're not listening to you. And so we're really working on shared vision, common language, connecting, positivity. Now we have the neurosurgeon interacting more with the environmental services employee, giving high fives through the hallway. And so that's one area that we strategize on. Again, why work at the hospital when the hourly rate isn't that much different? You have nights, weekends, holidays, mandates. You want to build a culture of excitement and positivity. And that's really what we've worked really hard on. We've had great success. And in fact, our employee engagement went up for the first time ever most recently, despite having COVID in the whole 9 yards. So that's one area we really strive on innovation in regards to employee engagement, positivity, change the context of your lens. One more story. This shows the effectiveness of the training because I personally kick off every training session and we host 2. It's 8-hour courses every week for our frontline staff to attend. Before I went through the training, I don't like the heat. I know you're in Florida, we're in Iowa. And I'd have my suit jacket on and think, geez, it's 90 degrees, it's hot, it's humid out. Oh, I'm already sweating. It's going to be an awful day driving to work. Now, after going through the training, I walk outside, I have my suit on and say, wow, it's a little warm, but it's a beautiful day. And what I tell the frontline staff, what if all 1,500 of us had that same context of our lens on how we deal with adversity? How do we deal with challenges? And if we can all address it in that same manner, we're going to be a lot better organization. And we've had great success and results from doing that.
I love these stories, and thank you for providing those examples. Definitely relatable on so many levels in terms of kind of you choose your own experience, no matter what the
Exactly.
situation is, and there's always two paths that you can choose one of them, but the decision is on you in terms of whether treating a particular encounter as an opportunity maybe to learn, or you letting that experience kind of drive whatever the case may be in terms of your overall productivity of the day. So that's exciting. I love those stories. We could probably spend the rest of the podcast talking about that.
I have so many different stories. I won't bore you with them.
No, that's great. That's great. I want to shift gears to another area I want to cover with you when it comes to talent acquisition and surrounding yourself with the top performers as an executive. That's it's at the top of your mind 24/7, whether you actively recruiting or not. And when it comes to your particular space, just share with us any practical recommendations or strategies that really help you succeed in the space of talent acquisition and attracting the top talent to your teams. Please kind of share some perspectives that you have found successful or maybe learned from.
Yeah, I'd say overall, who I try to hire are people that excel in areas that I don't excel in. So, for instance, the associate administrator or the number 2 individual at the medical center responsible for, I hired her about 5 years ago. And in fact, she was the first person who taught me how to do a budget 10 years ago. So I'm not always that strong on the actual technical side of the accounting, or the budgetary aspect. So I try to hire those individuals. I'd say on a global basis, try to work on grit. And what I define as grit, how do you deal with adversity? So when I do interviews or look for individuals to join the team, whether in senior leadership or middle management or frontline management, how do you deal with adversity? And I actually have a little checklist and an interview questionnaire all around grit, and then add up the scores, because I want to find people who are gritty, who are willing to roll up their sleeves. What does it take to get the job done, and how do you execute? Everyone can come up with ideas. We can all think, but who can drive the execution of those ideas to have the best goals achieved within the organization? So that's really what I look for personally. Twofold. One, who does aspects well that I don't maybe have the strongest strength in? And then secondarily, how gritty are the individuals who are able to deal with adversity and bounce through challenging times?
Right, absolutely. And to take that a little bit further, when it comes to retention, that adds another layer of complexity, because with so many opportunities out there available for, the top performers, you can't help but also focus on building that environment and fostering the environment of retention. Talk to us a little bit about, from that perspective, what really helps you succeed, create an environment.
Yeah, I think that's a great point, because there's two most important reasons why people stay at a job. Number one, their supervisor or manager. What's their relationship like? And then number two, how is the conversations and the work ethic with coworkers? Those are the two reasons. And we have these challenges. There's a major academic medical center, University of Iowa, who we value our partnership with, 45 minutes down the road. But why work here at Genesis when we don't match dollar for dollar 401k, not necessarily have the highest tier salaries? It's the culture. And so we really work hard, yes, at recruitment, but retaining staff members. And it comes down to the conversations and relationships with the direct hiring manager, as well as relationships within coworkers. And we actually have a whole department focused on, we call them retention specialists, that really work with our frontline staff members on having the right feel and fit within the organizations for a certain position. And if it's not the right fit, we'd much rather retain you within the overall organization if it's not a right fit within that department. So we value retention just as much as recruitment.
Right, absolutely. And it's such a complex area, which leads me to the further point. When it comes to interviewing, it's I'm yet to meet or see anybody who's really good at that, because it's a combination of art and the science. And when it comes to interviewing, I've observed that there's that flawed approach in general, where the focus is on that past experience, and also what are the different weaknesses that we can tolerate in that particular candidate. And you've actually mentioned that when you were talking about retention, when it comes to hiring for strength and versus that lack of weakness. What are we missing on this team? What are we not good at? And let's try to find somebody from that perspective. Give us a glimpse into an interview with Jordan. What do you look for in the responses when you meet with your candidates?
I'd say it's very short in my individual office and the technical side of the job. Figure if you get to this position, you understand the technical aspects. And if you don't understand, can teach or have individuals that can add value. What I want to see is, how do you interact as a person? So in fact, most of the interview, we spend about 90 minutes walking around the entire medical center. Do you address the housekeeper and say hello in the hallway? How do you interact in the elevator? Like, to get you outside of the medical center, have dinner with physicians, staff members. How do you interact in the dinner, have mutual respect, engage individuals? So really want to see, how does the member A exhibit him or herself, and then B, how do they interact in a team and then in social settings as well? So many aspects, in particular within healthcare administration, is showing empathy, connecting with people, being authentic, listening to new ideas. Because as president of the hospital, I don't know how everything operates. I have a great team, great physician leadership, and I see myself as more of the coordinator of resources. So how can we bring the resources to bear? Because frankly, the frontline clinical team members and physician leaderships, we have outstanding partners. And I like the phrase physician-led, professionally managed. And that means have the physicians lead, and we're there to support. And so I really see myself as a support and coordinator of resources. To get back to your question, because I get a little passionate on this topic, it's really seeing people outside of the four-room office of how do they interact, how do they show mutual respect, and what's the connection like within the team.
Right, right, absolutely. Definitely very interesting, unique perspective because it's also boils down to providing an opportunity for the candidate to ask the right questions and make the assessments from their side. And it sounds like you create that environment for a two-way street, two-way conversation, so that it's not just one-sided, you making that assessment, but also providing the candidate with that opportunity as well, which I think it's, sounds very simple, but oftentimes overlooked.
Yeah.
So, from your personal perspective, when it comes to your content diet, what do you consume on daily basis that really help you stay ahead of the curve for self-actualization of self-education? Share with us those sources.
Yeah, I like to network in particular, not just with individuals within the healthcare industry, but overall. But also, if we do different partnerships here at the hospital, keep in touch with those individuals. When I run into a challenge, might call them and say, "Hey, you might not work within the operations of imaging, but do you know someone who does that I can give them a call?" So I would say the biggest value add, yes, I love reading the Wall Street Journal. I love following your podcast, among other individuals' podcasts, but most importantly, networking, not only formally, but probably even more than formally, what I value the most, informal networking. Being able to call people and say, "How have you addressed this challenge? How do you see this? Am I seeing it in the right lens?" I was blessed 6 years ago when I became president of the hospital. My boss, the CEO of the health system, hired an executive coach for about 18 months. And I found that very, very important when taking on the role about self-perception. How do you perceive? How do people perceive you? How do you deal with challenges? How do you manage the emotions of the job? And so all of those aspects, I wouldn't say there's one key aspect, but probably the human personal connection has been the biggest value add on the quote unquote content diet of how to stay on the upcoming trends and deal with challenges in a positive light as well.
Right, absolutely. With so much information overload and availability, I'm always fascinated, to hear this, the some of the strategies that you utilize on daily basis to keep that cycle or almost what you let your mind be exposed to. I think it's very interesting. It's just it's fascinating. So last but not least, Jordan, what are you currently reading, and what is one book that you always recommend to others, and why is that?
I'm currently reading Switch, and it's How Do You Shrink the Change? Switch is by Chip and Dan Heath or Health, if I recall correctly. But it's all about shrinking the change. How do you pivot? How do you execute quickly? I'd say that's one currently reading, but probably one book I always recommend, and I touched on it earlier, The Happiness Advantage by Sean Anker, changing the context of your lens. It's been amazing. One last story to maybe end on how the medical staff has been engaged with this initiative. And frankly, if you're not familiar with hospitals, the medical staff's on board. Making change at the institution goes a lot easier because the frontline staff say, "Hey, Dr. A thinks it's important, so I'm going to follow Dr. A." But our anesthesiologist went through and read the book Happiness Advantage, went through the orange frog training, and literally carries around this orange frog in his little suit jacket before he sedates patients. And he sits down and he talks to patients and says, "Hey, I went through the training, Happiness Advantage, changing the context of your lens in a positive aspect. And this orange frog reminds me of this. This is why I carry it around." And thereby, the patients view him more positive. I'll tell you, he's the only provider we have, anesthesiologist, who's in the 99th percentile, the top 1% in patient experience. So it's all how you change your context, your lens. How do you deal with adversity? How do you deal with adversity right now in declining reimbursement, tight workforce shortages, the reimbursement challenges? And so that's my favorite book that I always recommend, hands down. And I encourage you to read it because it will change the context of your lens. Happiness Advantage by Sean Aker.
I appreciate those recommendations. Definitely going to add them to my growing list of books that I need to read this year. And for our listeners, we'll make those titles and authors available in the show notes. Jordan, can't thank you enough for your time today. Very short, insightful conversation. As with all other guests, I love doing the follow-up recording in about a year so we can revisit the conversation from a year ago, see how much of change transpired, and see if a lot of that stuff still makes sense. So I'm definitely looking forward to doing that with you.
Well, thank you. I appreciate the time and good to connect.